Age-related macular degeneration, or AMD, is the leading cause of visual impairment and blindness in older Americans. It affects the retina, the light-sensitive layer of the eye. In early AMD, yellowish deposits form under the retina. They can result in distortion and gradual blurring of vision. As the disease progresses, more and larger deposits develop, and blood vessels grow up from beneath the retina and leak blood. The leaked blood causes damage to the retina. In advanced AMD, peripheral vision may remain, but the ability to clearly see straight ahead is lost. Amblyopia is often referred to as lazy eye. A child with amblyopia doesn't develop the proper nerve pathway, sending fewer neuroelectrical signals to the brain than normal. The unaffected right eye is sending strong signals. The eye with amblyopia, the left eye, is sending fewer neuroelectrical signals. Left untreated, the pathways through which these signals travel may weaken and not develop properly, damaging the child's vision. Placing a patch over the unaffected eye for several weeks strengthens and stimulates impulses from the eye with amblyopia. This can improve vision in that eye to help restore normal vision. A cataract is a clouding of the lens in your eye that affects vision. Most cataracts are related to aging. To understand how a cataract can affect your vision, it helps to understand a little about the structure of your eye. The lens is clear and lies between the iris and the pupil. It works much like a camera lens, focusing light or an image on the retina. The retina is the light-sensitive tissue at the back of the eye. Once the light or image reaches the retina, it is changed into nerve signals that are sent to the brain. Besides focusing light on the retina, the lens also adjusts the eye's focus, letting us see things clearly both up close and far away. The lens must be clear for the retina to receive a sharp image. The lens is made of mostly water and protein. The protein is arranged in a precise way that allows light to pass through it without distortion. But as we age, proteins in the lens clump together, causing a cataract. At first, the protein may clump together and cloud in a small area of the lens. Over time, the clumps may increase in size and number, clouding more of the lens. If the lens is cloudy from a cataract, the image you see will be blurred and colors may appear faded. A clear fluid flows through the anterior segment at the front of the eye, nourishing tissues. At the open angle where the cornea and iris meet, the fluid flows through a spongy meshwork and leaves the eye. But if it passes through too slowly, pressure inside the eye rises to a level that damages the optic nerve, resulting in vision loss due to open-angle glaucoma. Untreated, the vision loss progresses from normal vision and no pain to gradual loss of peripheral or side vision and eventually total vision loss.
What do my eyes do when I'm sleeping?
Well, when you go to sleep, you close your eyes, so you probably think that your eyes rest. But there's actually a lot of activity that happens during sleep. We cycle through different stages of sleep, and that last stage of sleep is called REM, or rapid eye movement. So even though your eyelids are closed, your eyes are moving about, darting back and forth and up and down. Scientists are still a bit perplexed as to why your eyes do this while you sleep, but here's some interesting facts. One is, this is the period of sleep where most of your vivid dreaming occurs. Babies spend more time in REM than adults do. And when you look at the brain activity during this period of sleep, it's very similar to the brain activity when you're fully awake.
Why can't I see colors well in the dark?
We have specialized cells called rods and cones in the back of the eye that respond to light. Now, when it's bright light, the cones are activated, and they're actually used to discern different colors. But when it gets dark, they don't function so well. Rods, on the other hand, are very sensitive to low levels of light, but they don't discern color. So that's why when it gets dark, everything looks like an old-fashioned black and white movie.
A doctor explains cataract and how to prevent and treat the condition.
The eye has a lens within it which focuses light, and when this becomes cloudy, it's called a cataract. Cataracts develop naturally with aging and are very common changes in the older population. People will notice blurring of their vision or distortion. A very common scenario is driving at nighttime. Approaching headlights will appear to have a halo or starburst around them. And the reason is because the light coming into the eye, instead of passing through a nice clear lens, it's hitting what almost appear like crystals. And when the light hits this, it scatters. And so you can imagine this produces distortion and a glare effect within the eye. Cataracts are corrected by surgery. There's no medicine that reduces the impact or can make a cataract go away. Cataract surgery is very successful surgery. There are risks involved, as with all surgeries, but the outcomes are typically quite excellent. What can't be done by cataract surgery is vision that was lost from other eye diseases, either glaucoma or diabetic eye disease or macular degeneration. If someone has damaged their retina or nerve from other eye diseases, cataract surgery will not restore the vision that was lost from those problems. So there are two things that people can do to reduce their chance of developing cataracts. The first is not smoking, because smoking is one of the risk factors that leads to development of cataract. The second is protecting their eye from UV light exposure, from sunlight, the effects of sunlight, by wearing sunglasses. UV light exposure is associated with cataracts, but also causes other problems in the eye. So we recommend patients anybody wears UV protection sunglasses when out in the bright daylight. For more information about eye health, about finding an eye care professional, or about locating an organization that can provide financial assistance for eye care, please refer to our website. That's www.nei.nih.gov.
Vision is such an essential part of our lives. So much of what we do and enjoy depends upon the ability to see clearly. If your vision begins to fail, it can cause great anxiety. Understanding what is affecting your vision is the first step toward gaining some peace of mind. One of the leading causes of vision loss in people over 65 is a condition called age-related macular degeneration, also known as AMD. To understand how AMD affects your vision, it helps to know how the eye works. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, a light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina and the macula. The macula is a small area at the center of the retina. The peripheral retina is the large area surrounding the macula. It is the peripheral retina that gives us our side or wide-angle vision. It is the macula that gives us our pinpoint vision and allows us to see detail clearly, helping us to do things like drive, read, or recognize a face. Age-related macular degeneration, or AMD, is a breakdown of the macula. When the macula doesn't work properly, your central vision can be affected by blurriness, dark areas, or distortion. This condition affects many people as they get older. There are two forms of AMD. One is called atrophic or dry form. The other is called exudative or wet form. 9 out of 10 people who get AMD have the dry form. The retina is made up of many layers that are sandwiched together into a smooth surface. These layers work together, allowing us to see clearly. In people with dry AMD, the layer under the retina, known as the RPE, is affected by deposits called drusen, as well as other age-related changes. These changes may cause vision loss. A basic yet important tool for monitoring your vision is called an Amsler grid. You can use it at home to see if you have any changes in your central vision. You simply sit in a well-lit area and hold the grid away from you at a comfortable position. If you wear glasses, you should keep them on. Cover one eye and look directly at the point in the center of the grid. Pay attention to the pattern of lines in your side or peripheral vision. Then do the same with the other eye. Usually a vision problem from AMD makes some of the straight lines appear wavy or blurry. Some areas of the grid could look dark or even blank. If you notice any new changes in the grid, you should contact your ophthalmologist immediately. Noticing changes in the Amsler grid when you have dry AMD could be a sign that wet AMD is developing. With wet AMD, abnormal blood vessels begin to grow under the retinal layers behind the macula. These blood vessels leak fluid or bleed, which further blurs or distorts central vision. About 1 in 10 people with macular degeneration has the wet form. If your ophthalmologist thinks you have macular degeneration, he or she will run diagnostic tests to see what's going on with your macula. Depending on the form of AMD you have and other factors, your ophthalmologist will decide what the next steps are for preserving your sight. Early detection of AMD is critical to slowing down vision loss. In some cases, treatment might even improve vision. If you have any questions or concerns about your eyes or your vision, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight. Glaucoma is a leading cause of blindness for people over 60 years old. Unfortunately, only about half of the people who have glaucoma even know they have it. This is because it has no early symptoms. Eye doctors sometimes call it the sneak thief of vision. Glaucoma is a disease that damages the optic nerve. This nerve is responsible for sending visual messages from your eye to your brain. Glaucoma typically happens when the fluid in your eye does not drain as it should. Fluid gradually builds up and increases pressure in your eye. That pressure is what damages the optic nerve. Blindness from glaucoma can often be prevented with early treatment. Treating glaucoma won't bring back any vision you have lost, but it can help save the sight you still have. Let's take a look at how the eye sees and how glaucoma develops. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, the light-sensitive tissue lining the back of the eye. The retina sends signals through the optic nerve to the brain, where these signals become the images we see. In the healthy eye, fluid called aqueous humor is made in the front of the eye and flows out through a tiny drain called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If fluid doesn't flow out of the drainage angle properly, eye pressure increases and damages the optic nerve. There are several types of glaucoma, but the most common form is called primary open-angle glaucoma. This type occurs when the trabecular meshwork of the eye gradually becomes less effective at draining fluid. As this happens, your eye pressure rises, leading to damage of the optic nerve. As more optic nerve damage occurs, blank spots begin to appear in your field of vision. You probably won't notice these blank spots in day-to-day life until the optic nerve is significantly damaged and the spots become large. If the optic nerve is severely damaged, that eye will go blind. Eye pressure rises and falls from day to day and hour to hour. Therefore, a single eye pressure test may not detect glaucoma in some people who actually have the disease. This is why it is very important to see your ophthalmologist regularly. He or she will monitor your eye pressure, examine your optic nerve, and check for any vision loss that may have occurred. There is no single normal eye pressure number that applies to everyone. Optic nerve damage can happen at different eye pressures in different people. If your ophthalmologist determines that you have glaucoma or feels you are at risk for developing the disease, he or she will establish a target eye pressure specifically for you. That target pressure is to protect your optic nerve from damage. There are several ways to treat glaucoma depending on the type you have and how far it has progressed. The most common way is with eye drop medication. These medications lower your eye pressure in one of two ways. They either reduce the amount of fluid produced by the eye, or they help this fluid flow out of the eye through the drainage angle. Glaucoma eye drops must be taken every day as prescribed by the ophthalmologist. Surgery may be recommended for some people with glaucoma. Glaucoma surgery improves the flow of fluid out of the eye, helping to lower eye pressure. Treating your glaucoma is important for preserving your vision and your quality of life. If you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
Cataract is a common eye condition affecting millions of people, usually as they get older. A cataract is when the normally clear lens inside the eye becomes cloudy. Vision becomes dim or blurry, and driving at night may be more difficult. Things may appear less bright or colorful. Normally, the eye's lens is clear, allowing light rays to pass through and focus as they should on the retina. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it cannot focus clearly on the retina, and objects look hazy or blurred. If you are bothered by dim, hazy vision from cataracts, your ophthalmologist can restore clear vision with cataract surgery. This is a very common procedure. This is when your eye surgeon removes the cloudy natural lens from the eye and replaces it with an artificial lens. During cataract surgery, your ophthalmologist will make a small opening in the side of your cornea. He or she will insert a pen-shaped instrument through the opening to reach the lens. This instrument uses a special type of energy to break up the center of the cloudy lens. Then it will carefully suction out the lens pieces. Your surgeon will then insert an artificial lens, called an intraocular lens, or IOL. This IOL will stay in your eye permanently. The new lens lets light pass through and focus properly on the retina, bringing back clear vision. Once the IOL is in place, your ophthalmologist will close the incision, either with or without stitches. After surgery, a plastic shield may be placed over your eye to protect it. Surgery is the only way to remove a cataract. You do not have to have a cataract removed until it begins to affect your daily activities. Until then, changes to your eyeglass prescription may be all you need to improve your vision. Each year, millions of people find that cataract surgery improves their vision and their quality of life. If you have cataracts, discuss your vision goals with your ophthalmologist. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight. If you have diabetes, your body does not use or store sugar properly. This can cause changes in your veins, arteries, and capillaries that carry blood throughout your body, including your eyes. These changes can harm your vision. There are two types of diabetic retinopathy that can lead to vision loss. One type is called non-proliferative diabetic retinopathy, or NPDR. Another type is called proliferative diabetic retinopathy, or PDR. Let's take a look at how diabetes affects the eye. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, the light-sensitive tissue lining the back of the eye. The retina sends signals through the optic nerve to the brain, where these signals become the images we see. With non-proliferative diabetic retinopathy, or NPDR, damaged blood vessels in the retina begin to leak fluids, including small amounts of blood. Sometimes deposits of fats may leak inside the retina. These deposits are called hard exudates. With macular edema, fluid leaking from the retina's blood vessels can cause the macula to swell or thicken. Because the macula is responsible for our central or pinpoint vision, macular edema interferes with clear vision. Macular ischemia occurs when small blood vessels close. In this case, your macula is affected because it no longer receives enough blood to work properly. With PDR, many blood vessels in the retina close, preventing enough blood from getting to the retina. The retina responds to this problem by trying to grow new blood vessels. However, these new abnormal vessels do not provide proper blood flow. They can also bleed, as well as lead to scar tissue. That may cause the retina to wrinkle or even detach. That leads to vision loss. During an eye exam, your ophthalmologist will dilate or widen your pupils with eye drops and look inside your eye to examine your retina. Because certain conditions happen inside the layers of retina tissue, you may need to have a test called fluorescein angiography, or another known as OCT. These tests allow your ophthalmologist to see blood vessels within the retina. If you have diabetic retinopathy, your ophthalmologist will decide the best treatment option for you, depending on your condition. He or she may decide to use medication injections in the eye, laser surgery, other surgery, or a combination of options. The goal is to preserve the vision you still have and prevent further loss of sight. In some cases, treatment may even improve your vision. If you have diabetes, it's important to remember that maintaining strict control of your blood sugar and your overall health lowers your risk of losing vision. However, even if your blood sugar is controlled, diabetic retinopathy can still occur. For that reason, you should see your ophthalmologist at least once a year, or more frequently as recommended by your eye doctor, even if you're not having any visual symptoms. Also, if you have any changes in your vision, you should call your ophthalmologist right away. If you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight. Tears are a part of our human expression. They may flow freely in times of joy or sadness, but they are more than simply signs of emotion. Tears lubricate our eyes and make it possible to see the world clearly. When you blink, a tear film spreads over the eye, making the surface smooth and clear. The tear film is made up of 3 distinct layers: an oily layer, a watery layer, and a mucus layer. Each layer is needed for the tear film to keep our eyes moist. When tears are doing their job, we hardly think of them. But if our eyes don't produce the correct quality or quantity of tears, a condition called dry eye develops. Dry eye symptoms can include stinging, burning, itching, scratchiness, and irritation, as well as excessive tearing. Dry eye affects many people, particularly as they get older. Women after menopause are particularly susceptible to dry eye due to a decrease in the tear film's oil and mucus layer. Some medications may also have dry eye symptoms as a side effect. If you are bothered by symptoms of dry eye, talk with your ophthalmologist. He or she will examine your eyes and may do tests to measure tear quality and quantity, as well as look for dryness across the surface of the eye. Fortunately, there are treatments for dry eye. These include using artificial tears to lubricate the eyes, using eye drops that improve the tear film quality, keeping tears from naturally leaving the eye by closing the tiny tear drainage channels in the eyelids, preventing tears from evaporating by adding humidity to dry environments, and avoiding overly warm rooms, hair dryers, smoking, and wind. For treating scratchy eyes when waking, your ophthalmologist may recommend you use a special artificial tear ointment or thick eye drops at bedtime. Dry eye is a very common problem, but you don't have to suffer with it. Talk with your ophthalmologist to find out how to make your eyes more comfortable. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight. For us to see the world around us, light enters the front of the eye and passes through the vitreous before it's focused on the retina. The vitreous is a clear gel-like fluid inside the eye. The retina is the light-sensitive tissue lining the back of the eye. Often, tiny clumps of cells form inside the gel-like vitreous. These clumps cast shadows on the retina. These are what we call floaters. They can appear as dots, circles, lines, clouds, or cobwebs in our field of vision. Floaters are more common as we reach middle age. This is the time in our life when the vitreous gel may start to thicken and shrink, forming clumps or strands. If the vitreous gel is rubbing or pulling at the retina, you may see flashes of light, or what we simply call flashes. Most floaters and flashes are harmless. However, when the vitreous shrinks, it can sometimes tear the retina as it pulls away from the wall of the eye. If these tiny tears bleed, new floaters may appear. A torn retina can lead to a more serious problem called a detached retina. This is where the retina lifts up from the back of the eye. A detached retina can cause permanent vision loss if it is not treated right away. Floaters and flashes may be warning signs of a retinal detachment when you have a sudden appearance of new floaters or many floaters, shadows in the side of your vision, seeing something like a gray curtain moving across your field of vision, seeing flashes, especially with new or many floaters. If you have these symptoms, call your ophthalmologist right away. Treating a torn or detached retina immediately can save your vision. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
Blepharitis is a common condition where the eyelids become red, swollen, and crusty. Eyes feel irritated and itchy and can sting or burn. With blepharitis, oily particles and bacteria coat the edge of the eyelid near the base of the eyelashes. Sometimes, oil glands in the eyelid clog up and swell. This can cause a stye, a painful red bump near the edge of the eyelid. In some cases, these conditions slowly damage the edge of the eyelid. It is not completely clear what causes blepharitis. However, doctors know that it is often related to a number of conditions, including bacterial eye infection, acne, rosacea, and dry eye. Everyone has bacteria on the surface of their skin, but in some people, bacteria thrive in the skin at the base of the eyelashes. Large amounts of bacteria around the eyelashes can cause dandruff-like scales and particles to form along the lashes and eyelid edges. Some other conditions that can lead to blepharitis include problems with the eyelid's oil glands and the presence of microscopic organisms called mites at the root of the eyelashes. Often, blepharitis is a chronic or ongoing condition. However, practicing good eyelid hygiene is an important way to keep blepharitis under control. Follow these steps for cleaning your eyelids to control blepharitis. Apply warm compresses to your eyes for at least 5 minutes. This should be done once or twice every day. To make a warm compress, you can wet a clean washcloth with hot water, wring it out, and place it over your closed eyelids. As the washcloth cools, re-wet it with warm water. Another option that holds warmth longer is to heat a bag of rice or a gel pack in the microwave. Whatever you do, be sure not to make the compress so hot that you burn your skin. Warm compresses will loosen dandruff and crustiness around your eyelashes. It also helps break down oil from nearby oil glands. Eyelid cleaning should be done once or twice a day. Soak a clean washcloth, cotton ball, or lint-free pad in baby shampoo diluted with warm water. Gently rub the base of your eyelashes with the shampoo, then rinse with warm water. Your ophthalmologist may be able to tell you about other products designed for lid cleaning. Your ophthalmologist may prescribe an antibiotic ointment. Using a clean fingertip or cotton swab, gently apply a small amount of antibiotic ointment at the base of the eyelashes before bedtime. Sometimes an antibiotic that you take by mouth will be prescribed. Your eye doctor may also suggest that you add omega-3 fatty acid oils to your diet. These come in capsule form. If you're bothered by swollen, red, and crusty eyelids from blepharitis, be sure to follow these steps for good lid hygiene every day as recommended by your eye doctor.
When using eye drops, it's important to put them in correctly. This prevents eye infection and ensures that you are getting enough of each drop into your eyes. Here's how to put in eye drops. Wash your hands with soap and water. Dry your hands with a clean towel. Shake the eye drop container. Remove the cap from the eye drop bottle and place it on a clean tissue. Don't touch the dropper tip with your hand or any object. Eye drops must stay clean. Tilt your head backward with both eyes open and look at a point on the ceiling, or lie down on your back. Gently pull your lower eyelid down to form a pocket for the drop. Place your hand holding the bottle on top of the hand holding your eyelid to properly position and steady your hand. Turn the bottle upside down. Put the tip of the eye drop bottle over the pocket, but don't let it touch your eyeball or lower lid. If the eye drop doesn't immediately come out, gently squeeze the bottle to allow the drop to fall into the pocket. Close your eyes without blinking or squeezing them. Keep your eyes closed and gently blot away any drops outside of the eye with a clean tissue. Keep your eyes closed for at least 2 minutes or as prescribed by your eye doctor. Finally, replace the cap on the eye drop bottle. If you are scheduled to have a comprehensive eye exam or vision screening, you are taking an important step in caring for your eyes. Keeping your appointments with your ophthalmologist is a vital step in preserving healthy vision. To help you understand what to expect during your visit, let's take a look at what may happen as part of your exam. When you go into the exam room, your ophthalmologist will ask if you are having any eye or vision problems. You will be asked to describe these problems, including how long you have had them. You will review your history of glasses or contact lenses. Your ophthalmologist will then ask about your overall health, including any medications you take and your family's medical history. During the discussion, your ophthalmologist may look away to make notes on the computer to keep proper records for your visit. Despite having to look away, rest assured that your ophthalmologist is listening to you. The eye doctor will check your vision, or what we call visual acuity, using a Snellen chart. This is the chart with the random letters in rows that become smaller line by line. You will be asked to read the lines of letters until you can no longer see them. To see if you need glasses or a new glasses prescription, the ophthalmologist will place several lenses in front of your eye, one at a time. He or she will ask you when the letters on the Snellen chart become easier to see. This is called a refraction test. The chair you sit in has equipment attached to it. This is called the slit lamp microscope. This device allows the doctor to see the inside and out of your eye up close. You will rest your chin in the chin rest attached to the instrument and place your forehead against the head support. Be sure to move your whole body to the edge of the chair and as close to the slit lamp as possible. Your ophthalmologist will then shine a light into your eye and look through the magnified lens. He or she will examine the clear surface of the cornea, the white of your eye called the sclera, and the colored iris. For an eye pressure check, you will have anesthetic drops put in your eye. As you sit very close to the slit lamp, your doctor will guide an instrument very gently so that it's just touching the front of your eye. This test, called tonometry, is used to detect and monitor glaucoma when you have increased eye pressure. Your ophthalmologist will check your side or peripheral vision. You will cover one eye, and the doctor will ask you to focus on a target in front of you and describe what you see out of the corner of your eye, so to speak. He or she may use their upraised finger as a target, or you may sit at a machine that has blinking lights appearing in different places. You will be instructed to press a button whenever you see a light. If your eye doctor plans to examine the retina and the optic nerve at the back of your eye, he or she will put eye drops in your eyes to dilate or widen your pupils. It takes about 15 to 20 minutes for your eyes to dilate. Looking through the slit lamp again, your ophthalmologist will check the back of your eye. This area is called the fundus. It includes the retina and nearby blood vessels as well as the optic nerve. Your doctor may also use a handheld device called an ophthalmoscope to help closely see the structures at the back of the eye. After being dilated, your eyes will be sensitive to light for a few hours. Sunglasses will help when you go outside. There are other tests that may be performed as part of your eye exam. Your ophthalmologist will decide which tests you need based on your medical history and what he or she finds during the exam. If you have any questions about the exam, be sure to ask your ophthalmologist or a member of the eye care team. He or she will be happy to explain why certain tests are done, as well as how to care for your eyes. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight. You might be surprised to know that nearly half of all eye injuries occur at home. Repairs, yard work, cleaning, and cooking can pose a danger to your eyes if they aren't protected. A survey by the American Academy of Ophthalmology found that only about 3 out of 10 people say they always wear protective eyewear when doing home repairs or maintenance. That's why eye experts urge every household to keep at least one pair of ANSI-approved protective eyewear on hand. ANSI, or the American National Standards Institute, sets a safety standard for protective eyewear. You can find ANSI-approved safety glasses and goggles at most hardware stores. Wear your safety glasses for activities in and around the house, such as cleaning with hazardous chemicals such as bleach and cleaners that can splash or spray into eyes, cooking with grease or oil that can splatter, drilling, hammering, or using power tools where pieces can fly off the surface, mowing or trimming outside where debris flies into the air, playing ball games or playing with toys that have flying pieces, such as Nerf guns for instance, and using fireworks or sparklers. It's best to just leave the fireworks to the trained professionals. Did you know an estimated 9 out of 10 eye injuries that happen each year could have been prevented simply by wearing protective eyewear? Safety glasses or goggles can prevent a lifetime of lost vision from eye trauma. Don't leave your vision to chance.
Contact lenses provide millions of people with a convenient way to correct their vision. To keep your contacts and your eyes in good shape, proper cleaning and storage of the lenses is so important. Otherwise, you put your sight at risk. Eye infections can be very serious, enough to cause severe eye damage and even vision loss. The single best way to avoid contact lens-related infections is to care for the contacts exactly as prescribed by your eye care professional. It is very important to replace your contact lenses as recommended by the manufacturer and your eye doctor. This helps reduce your risk of developing eye infections. Make a chart to remind yourself when to replace the lenses. Also, many ophthalmologists caution against extended wear contacts, since sleeping in them does increase your risk of infection. Talk with your ophthalmologist about your vision needs and expectations to learn what types of contacts may be better for you. There are other important things to do that will help reduce your risk of infection with contact lenses. First, include a rub and rinse step in the lens cleaning process. During cleaning, rub your contact lenses with your fingers, then rinse the lenses with solution before soaking them, even if the solution you use is a no-rub type. Rinse the contact lens case with fresh solution, not water. Then leave the empty case open to air dry. Another way to reduce the risk of infection with contacts is to avoid contact with water. Remove lenses before going swimming or in a hot tub. Do not rinse or store contacts in water, tap or sterile. Never put your lenses in your mouth to wet them. Saliva is not a sterile solution. Also, do not use saline solution and re-wetting drops to disinfect lenses. They do not thoroughly disinfect your lenses. Finally, don't forget to care for the lens case too. It can be a source of contamination and infection if not handled properly. Keep the contact lens case clean. Replace the lens case regularly, at least every 3 months. Do not use cracked or damaged lens cases. Know what the symptoms of an eye infection are. Symptoms of a possible eye infection include eye redness, pain, tearing, increased light sensitivity, blurry vision, discharge from the eye, and swelling. If you have any of these symptoms while wearing contacts, remove the contact lenses and call your eye doctor immediately. Eye infections must be treated right away to avoid severe problems and possibly blindness. Make sure to keep regular appointments with your ophthalmologist. He or she will check to make sure your contact lenses are safely giving you the best vision possible. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight. To understand how we see clearly, we need to understand how the eye works. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, the light-sensitive tissue lining the back of the eye. The retina sends signals through the optic nerve to the brain, where these signals become the images we see. 70% of the eye's focusing power comes from the cornea and 30% from the lens. When we can't see clearly, it's often caused by what we call a refractive error. There are 4 types of refractive error. Myopia, or nearsightedness, is where the distance between the cornea and the retina is too long. Light rays focus in front of the retina instead of on it. With myopia, close objects will look clearer, but distant objects will appear blurred. Hyperopia, or farsightedness, is where the distance between the cornea and the retina is too short. Here, light rays are focused behind the retina instead of on it. Distant objects will look clear, but close objects will appear blurred. Astigmatism is when the cornea is unevenly curved. Usually the eye is round like a baseball, but with astigmatism, it is more oval-shaped like a football. Light passing through this unevenly shaped cornea is not properly focused on the retina. Distance and close vision may both appear blurry. Presbyopia is a normal condition that typically starts around middle age. This is when the eye's lens becomes less flexible and less able to focus on close objects. The typical sign of presbyopia is the need for reading glasses. Refractive errors are corrected by refocusing light rays properly onto the retina. This can be accomplished with eyeglasses or contact lenses or with refractive surgery. Today, there are many ways to correct refractive errors, bringing the world around you into clearer focus. If you are looking for ways to see better, talk with your ophthalmologist. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
Amblyopia is an eye condition that many people refer to as lazy eye. It is when you did not develop normal sight in an eye during early childhood, and that eye now has poor vision. Usually, only one eye is affected by amblyopia, but it is possible for both eyes to be lazy. Amblyopia is a common vision problem among children, and it has a number of causes. For instance, it can develop because the eyes are not lined up equally with each other, or it can be caused by light not focusing properly in one eye, resulting in blurry vision in that eye. With amblyopia, vision loss happens because the brain favors the eye with stronger vision and basically ignores images from the weaker eye. Amblyopia is not always easy to spot. A child may not be aware that one eye is weaker than the other. Unless you notice an obvious symptom, such as one of the child's eyes pointing in a different direction than the other one, you may not know they have lazy eye. Treating amblyopia early is critical to saving sight. Leaving it untreated puts a child at risk for a lifetime of vision problems. The child may lose depth perception, which is the ability to tell how far an object is from you, and he or she may permanently lose a significant amount of vision in the weak eye. To treat amblyopia, you must make the weaker eye stronger in order to see normally. There are two ways that pediatric ophthalmologists do this. They may have your child wear a patch over the stronger eye, or they may blur the vision in the child's stronger eye with special eye drops or eyeglasses with a blurry lens. In either case, the child is forced to use the weaker eye. Understandably, children do not like to have their strong eye patched or blurred. However, parents need to help their child do what is best for him or her. If your child is resisting wearing a patch for amblyopia treatment, here are some tips to help make it more successful. Provide a reward to your child for keeping the patch on for the prescribed amount of time. Have your child wear the patch while doing his or her favorite activities, like watching a movie or playing a video game. Ask family members, teachers, coaches, and others to provide plenty of encouragement and praise to your child when they wear the patch. Your pediatric ophthalmologist can discuss ways to work with your child to make sure they wear the patch as recommended. As a parent, you can make sure your child's amblyopia treatment is successful. Stay interested, stay involved, and be persistent. Your child's vision depends on it.
Millions of people struggle with seasonal allergies. In areas where there are a lot of trees, pollen is the culprit, causing a runny nose and red, itchy, watery eyes. Allergic conjunctivitis is what we call eye allergies. This happens when the eyes react to something that irritates them, called an allergen. Our eyes produce a substance called histamine to fight off the allergen. As a result, the inside of your eyelids and the white part of your eyes become red, swollen, and itchy, and they can tear and burn. Unlike bacterial or viral conjunctivitis, allergic conjunctivitis is not spread from person to person. Allergy medicine, including over-the-counter products and prescription drugs, can provide relief from seasonal allergies. Here are 5 other steps you can take to minimize the misery of seasonal allergies. Wear sunglasses or eyeglasses whenever possible to protect your eyes from pollen. Keep windows at home and in the car closed so pollen doesn't blow in. Remove your jacket, hat, and shoes as soon as you enter the house to avoid tracking pollen inside. Also, don't hang laundry outside to dry. Shower before bed to remove pollen from skin and hair. Monitor the pollen count each day, either online or through your local weather forecast. Try to spend less time outside when the pollen count is very high. Following these tips may help bring relief from seasonal allergies. If you have any questions about eye allergies or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
We all know that smoking tobacco is hazardous to your health. But did you know that smoking directly impacts your eyes as well? Smoking, even as early as in your teens or 20s, puts you at greater risk for certain eye diseases later in life. One disease in particular, called macular degeneration, steals much of your vision and may not be treatable. We also know that the more a person smokes, the higher their risk of developing eye disease. There is some good news, though. Studies found that after people quit smoking, their risks for some eye diseases dropped to nearly the same as for people who never smoked at all. If you smoke, think about the impact it can have on your eyesight. The American Cancer Society has resources to help people who want to quit smoking. To find out more, visit them online at www.cancer.org.
Diabetic eye disease refers to a group of eye problems that can occur as a result of diabetes. Without diagnosis and treatment, diabetic eye disease can cause severe vision loss or even blindness. Diabetic retinopathy is the most common diabetic eye disease and is a leading cause of blindness in persons with diabetes. It is caused by changes in the blood vessels of the retina. The retina is the light-sensitive tissue at the back of the eye. A healthy retina is necessary for good vision. In some people with diabetic retinopathy, blood vessels of the retina may swell and leak fluid or blood. In other people with diabetes, abnormal new blood vessels grow on the surface of the retina. At first, diabetic retinopathy may not cause any changes in vision, but over time, diabetic retinopathy can get worse. At first, a person might see spots floating in their vision, or may notice a general blurring of vision. Eventually, diabetic retinopathy may cause vision loss and even blindness.
The comprehensive dilated eye exam, opening the door to preventing blindness. During a comprehensive dilated eye exam, the patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. With a better view of the back of the eye, the doctor can look for signs of the common eye diseases that can lead to blindness: glaucoma, diabetic retinopathy, and age-related macular degeneration. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. This is the optic nerve. The doctor is looking for early signs of glaucoma. This patient's optic nerve is healthy, but here's what it would look like if it showed signs of glaucoma. The doctor will see changes in the shape or color of the optic nerve. The doctor may also see what is called cupping of the optic disc. Glaucoma is most common in African Americans over the age of 40, people over 60, and in people with a family history of glaucoma. In addition to the optic nerve, the doctor can also clearly see the retina at the back of the eye. The doctor might see signs of diabetic retinopathy. Early diabetic retinopathy starts with small red dots called microaneurysms and can progress to leaking blood vessels, causing thickening of the retina and blurring of vision, or new blood vessel growth that can bleed and cause blindness. If you have diabetes, you are at risk for diabetic retinopathy. While still examining the retina, the doctor can also look for signs of age-related macular degeneration, or AMD. If this patient had AMD, the doctor would see yellow spots beneath the retina, called drusen, or dark clumps of pigment. AMD is the main cause of visual impairment and blindness in older Americans. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about comprehensive dilated eye exams, common vision problems, and eye disease, visit www.nei.nih.gov/healthy eyes.
A doctor explains dry eye and how to treat the condition.
Dry eye disease is very common. In fact, among women over the age of 50, a significant portion suffer from some form of dry eye disease. And what this is a feeling of irritation, burning, a sandy sensation as if there's something in the eye. Dry eye occurs because the eye is no longer making as many tears or the same quality of tears as it used to. So the way we treat dry eye is by having a patient use artificial eye tears, eye drops, which they purchase over the counter. And these can be used as often as they like, but typically 4 times a day would be an effective treatment regimen for dry eye. In more severe cases, there are some prescription eye drops which can be helpful. In some cases, dry eye is treated also with management of their eyelids with hot compresses and scrubs to help the glands work better around their eyelids. For more information about eye health, about finding an eye care professional, or about locating an organization that can provide financial assistance for eye care, please refer to our website. That's www.nei.nih.gov. eye.gov.
The primary components of tears, mucin, aqueous, and lipid combine to create a complex viscoelastic structure. This complex structure is responsible for a multitude of important functions. Lipids prevent evaporation, lubricate, and stabilize the tears. The meibomian glands produce the lipid layer of the tear film in the eye. The lipid layer protects the eye's natural moisture, or aqueous, and allows the eyelid to glide safely over the eye. Cells on the inner wall of the meibomian gland acini produce oil. In a normal eye, when you blink, the lids touch and pressure is applied to meibomian glands, causing them to express small amounts of this oil. The upper lid then pulls the oil upward over the eye as the lid opens. When the gland becomes blocked, there is not enough oil to coat the tear film, and the aqueous evaporates rapidly. Without adequate lubrication between them, the eyelids and cornea can abrade each other, causing inflammation and cell damage to the lid wiper and cornea. Simply removing meibomian gland blockage isn't enough. The acini may not start producing oil again until the accumulation of dead cells within them are flushed. Excessive evaporation of the tear film due to a poor lipid layer from MGD can lead to increasing discomfort, poor vision, inflamed lid margin, and damage to the ocular surface. When MGD is not treated, blockage of the glands results in downregulation of oil production, eventually causing the glands to atrophy, lose function, and drop out. Completely atrophied meibomian glands lead to chronic discomfort and potentially sight-threatening damage to the ocular surface.
Your eyes allow you to see the world around you, but have you ever wondered how they work? First, it's important to know that vision depends on your brain as much as on your eyes. Your eye's main job is to detect patterns of light. Then, they work with your brain to turn those patterns into images. Let's take a closer look. Light rays bounce off an object you are looking at. Let's say the object is a dog. The light reflects off the dog to your eye. Then the light enters through the outer part of your eye, called the cornea. The cornea is clear like a window. It helps your eye focus the light to make things look sharp and clear. Next, the light rays pass through an opening called the pupil. The pupil is the dark round circle in the colored part of your eye. The colored part is called the iris. It controls how wide the pupil is and how much light can pass into your eye. In bright light, the iris narrows the pupil, reducing the amount of light that enters the eye. In dim light, the iris widens the pupil to let in more light. All of this happens automatically. Behind the iris is the lens of the eye. It helps focus the light coming into your eye so you can see things clearly. The lens flattens so you can see things that are far away, and bends so you can see things up close. When the lens, cornea, and pupil are all working together properly, they will focus light on the back of the eye. That's important, because lining the back of the eye is the retina. There are about 130 million tiny cells in the retina that are sensitive to light. When these cells detect light, they turn it into electrical signals. Those signals eventually make their way through the optic nerve, which is like a cable connecting the retina to the brain. The retina helps create a rough image, but it sees the world upside down. It's your brain that turns what you see right side up. Also, when you look at an object, each eye gets a slightly different view of the world. The brain combines those views and makes them into one picture. The brain also adds a lot of details to your vision, so that you can see complex shapes, movement, depth, and a rainbow of colors. And of course, the brain connects your sense of sight to things you already know, so that when you see a dog, you recognize it as a dog, and not a cat or a monkey. And that's how you're able to see. To learn more about how your eyes work, visit nei.nih.gov/kids.
I want to talk to you about a problem that affects millions of us: dry eye. We don't all have the same dry eye symptoms. Sometimes I get so irritated, I water more than usual, or I can get red and sting. Sometimes I feel like I'm in a hot desert sandstorm with no shelter. There are lots of reasons dry eye occurs: allergies, air pollution, asthma medication, spending too much time looking at the computer, and so many more. I went through all the possibilities. Luckily, there are plenty of do-it-yourself solutions to help ease the symptoms quickly. And for most of us, a few simple lifestyle changes will do the trick. If these simple changes don't work and your eyes are red and painful, visit your ophthalmologist right away. Dry eye can be a sign that something else is going on with our body. Learn more on how to say bye to dry eye. Visit the American Academy of Ophthalmology iSmart website.
Myopia and eye development. When babies are born, their eyes are hyperopic, or farsighted, meaning that their eyes are too short front to back. This means light focuses behind the retina, making close-up images blurry. By age 4, most children's eyes naturally start to elongate, correcting the hyperopia. However, in some children, this eye growth either doesn't stop or it restarts, leading to myopia. Myopia development usually begins when children are school age. Rather than growing proportionally, the developing eye starts to grow too long. This usually progresses until the eye reaches its adult size. In a myopic eye, light focuses in front of the retina, making faraway images blurry. Blurry distance vision can be corrected with lenses, which refract light entering the eye to refocus it properly on the central retina. However, regular glasses do not slow myopia development. High myopia can lead to blinding conditions like retinal detachment in later life. Researchers are exploring ways to slow myopia progression in children. National Eye Institute. Learn more about myopia at nei.nih.gov/myopia.
Optomap, ultra-wide-field retinal imaging. We all want to protect our gift of sight, which is why regular eye exams are so important. Regular eye exams not only allow your vision to be checked to determine if you need glasses or contact lenses, but also to assess your overall eye health. Even if your sight is fine today, it may still change over time. Early signs of many eye and systemic diseases may appear on your retina long before you notice any symptoms. The earlier these signs are detected, the greater the chance that the treatment will be successful. To help preserve the health of your eyes today and in the future, this practice offers Optomap ultra-wide-field retinal imaging, which is suitable for every patient, including children, at every eye exam. Let's take a closer look at Optomap and the eye itself. What is the retina? The retina is a thin layer of cells lining the back of the eye and covers 65% of the inner surface. The retina works by converting light into impulses and then sends them to the optic nerve, which in turn carries them to the brain. If damage occurs to your retina, your vision is at risk of deterioration. Traditional methods of examining the eye allow only a narrow field of view of your retina, similar to shining a flashlight into a dark room. A fundus camera photo may be taken so that a view of the central retina is captured. However, the fundus camera shows only approximately 15% of the retina at one time. Because this practice offers Optomap retinal imaging, we are able to capture up to 82% of the retina in a single image capture. This means that early signs of retinal disease can be detected more efficiently and effectively than with traditional, smaller field imaging methods. Sometimes, symptoms can go unnoticed in the early stages of any disease or ocular condition, and you only realize there is a problem when you experience changes to your vision. In addition to eye conditions, signs of other systemic diseases can also be seen in the retina. Early detection is vital and means successful treatments can be administered to reduce the risk to your sight and health. Having an Optomap is quick and takes less than a second. Images can be taken through small pupils and most cataracts. At the discretion of your eye doctor, Dilation drops may not be necessary. This means that you are able to drive home and carry on with your day. Your doctor may show you your retinal image in a unique 3D wrap sequence. Optomap images are digital and stored for comparison of previous and current images. Viewing your Optomaps over time allows your eye care professional to detect and monitor any subtle or significant changes. Autofluorescence imaging shows how the retina is functioning. This means that any signs of retinal stress can often be seen before any structural damage takes place. It's important for children to have a regular eye exam, as many vision problems can begin at an early age. Good vision is essential for their physical and educational development. Optomap was invented by Douglas Anderson when his son Leif went blind in his left eye at age 5. Unfortunately, a retinal detachment was detected too late for treatment. In an effort to improve the standard of care available during an eye examination, Douglas, an engineer, worked for 10 years to commercialize the Optomap. More than 400 completed and ongoing clinical studies support Optomap ultra-wide-field retinal imaging, which is becoming a recognized standard of care in many practices. Optomap ultra-wide-field retinal imaging helps you and your family maintain healthy eyes. This practice recommends that every patient has an Optomap retinal image. Ask for an Optomap today.
For most people with healthy vision, this is what it looks like around a city street. But the scene looks different for people with cataracts. When you have a cataract, the lens of your eye gets cloudy, and that can make your vision blurry. Do you see how there's a brownish tint to the street scene? Having a cataract is like looking through dusty glass. Over time, cataracts can also make seeing colors harder, especially blue and purple. And people with cataracts may be sensitive to bright lights and see glare. Cataracts are common, especially in older adults. The good news is that eye doctors can treat cataracts with surgery, and you can go home the same day. Learn more about eyes and eye health at nei.nih.gov.
If you suffer from eye floaters, then you're already familiar with the frustrating visual disturbance caused by these cobweb and cloud-like shadows. Eye floaters often result from the natural process of vitreous deterioration. Vitreous humor is the clear, jelly-like substance in the main chamber of the eye. Over time, as the eye ages, this vitreous humor can degenerate, resulting in the formation of eye floaters. Whilst floaters do not generally affect visual acuity, they can negatively affect quality of vision. Eye floaters are more likely to develop in people who are nearsighted, have diabetes, or who have had a cataract operation. A floater's impact depends on its size, density, and location. These characteristics also determine whether it can be treated.